أعوذ بالله أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام عليكم ورحمة الله وبركاته.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Can you hear me?
Yes, I can hear you very well. May Allah bless you for coming. May Allah make it easy for each and every one of us. So welcome to Gifted Mothers Group. Let me give a little introduction of about our support group. I had the need to start this group because I kept getting mothers of special need children coming to me for counseling. I can see that taking care of these children was very stressful for them, and they needed a continuous support on how to take care of themselves, how to, take care of their kids, and how to even help themselves so that they won't have, same kind of issues again, or having the same child. Because I have someone that have, I think, 3 deaf children. So I was wondering that what happened, the first one, the second one, at least I believe if we are aware of these disabilities, it will help us to help ourselves and others. Hence, bringing everybody together so that at least those with sickle cell children can say, okay, this is the hospital I use, there's this support program here that we can attend. Those with Down syndrome children can say, okay, this is what I did that helped me, this is how I managed the child and all. We also even had the case of a child that has cerebral palsy that started menstruating. And really, I don't have experience. And the mother was like, do anyone have experience of such? What do I do? This child cannot walk, this child cannot help herself. So being in a support group, it makes us feel or know that our problems are not peculiar to us. It gives us this sense of belonging, that Allah has not left us alone. You are not the only one Allah has tried. So the more we learn about disabilities and how to manage them, the better we become. So that was the essence or the story behind the group. So you are all welcome. May Allah bless you for coming. So without much ado, I'll be introducing our doctor, our pediatrician. So please, Sister Dr. Amina, first of all, let me thank you for coming. May Allah bless you. In short, I was thinking, subhanAllah, where do we get a doctor that will come here? Who do we even call? So I started thinking, I said, subhanAllah, let me message our sister, and immediately she accepted. May Allah bless you. May Allah never deprive you of the reward. Amen. So you're welcome, Amen. Dr. Amina. Please take the floor. Bismillah. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Okay. Alhamdulillah Rabbil Alameen. Salatu wassalam ala Nabi Muhammad sallallahu alayhi wa sallam wa ala alihi wa ashabihi wa ajma'in. Rabbi shrah li sadri wa yassir li amri wa hlul uqdatan min lisani yafqahu qawli. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa barakatuh.
I hope I am clearly clear.
Very, very clear.
Okay, alhamdulillah. So I'm actually quite grateful for you having me to speak today. It's actually an honor for me to be among such extremely strong women, because you need to first and foremost accept that you are extremely strong women and that you have been specially chosen by Allah to be the one to birth, to nurture, to protect, to provide for this special group of children. It's not everybody that can do it and do it successfully. So we need to have that at the back of our mind, that we were specially chosen. It didn't happen by chance. It is what Allah had destined for us. And as everyone has what is used as his or her own test in this world, we consider it as part of the test that we need to pass. Because once Allah had told us in the Quran that we will be tested, The whole idea is, okay, I know I'm going to have a test. If you know you're going to have an exam, what do? You read and make sure you pass. So once you know you're going to have an exam, you make sure you have whatever you need to be able to make that exam work. Now, as a pediatrician, I tend to come across several children that have special needs. And the word special needs, it's a very broad terminology. It refers to a whole lot of children. So I may not be able to go into the nitty-gritty of every single situation. So, and if I per chance not mention someone's own particular condition, you can let me know when we are having the little discourse towards the end of the discussion. I don't know, I was not given a time frame. I don't know how many minutes I have to speak. Let me know how fast or how slow I can talk.
Inshallah, 1 hour, 15 minutes.
1 hour.
15 minutes.
Okay, well, let me get
1
my
hour,
water
15
and my food.
minutes. 1 hour, 15 minutes.
Wonderful. Okay, that's a lot of time.
Mashallah.
All right. Inshallah, I hope I'll be speaking for 1 hour, 15 minutes. So I come across a lot of children that have special needs. And usually their needs range. It's a spectrum. You have kids who have just mild deficit in maybe one area. Maybe the child is just hard of hearing. He actually hears, but he doesn't find it easy to hear. Very mild disability. And then you have those who need constant care for everyday activity because their disability is actually quite severe. So these kids are usually in a spectrum. So irrespective of whatever spectrum you find yourself, once you have a child who has special needs, it is a challenge for us as mothers, because whether we like it or not, we're the ones who do the bulk of the caring for kids. So it's actually how the child will be able to navigate everyday challenges depends on us a lot. To this end, I always say to mothers that this baby that you have, he is unique in his own very way or in her own very way. And this child needs to be treated based on her own condition. I have a lot of mothers who will come and be like, but so and so, they were born at the same time. This one has started sitting. My child is not yet sitting. And I have to tell them that, no, you know what? Your child is unique. He has his own issues that he has come to this world with. So we need to deal with this child as his issues determine. And we try to encourage them to avoid comparison. Avoid comparison. Once you have a child that has special needs, you need to focus on that child and try not to think that, oh God, the other child I had, by this time, she was already walking, or she wasn't giving me this amount of stress. The child did not choose to be in the situation that he is. He just found himself in that situation. So it behoves on us to try to be able to navigate these challenges without making the child feel like he or she is a burden on us. Definitely, it will not be easy. It is definitely test our faith, because once you have a special needs child, it is a major test of one's faith. And it will really shake our resilience. Somebody who thinks that, no, I am very patient, I'm very strong person. Having a special needs child can actually put that to a very stringent test. And it will hurt, because you will go to places, you will see other people with kids who are perfectly okay, and you'll be wondering why. Why is it mine that has this issue and I cannot find a solution to it? And it's just the nature of life. You'll see your own child struggling to do what other children just do in a breeze, and you will definitely feel hurt when that happens. However, like I always say, we tell them to take comfort in knowing that Allah, who has given you this child as an amana, is rewarding us constantly for our patience and perseverance in the challenges that these children have found themselves in. And we also, as their parents, have found ourselves in. So In this life's trial and struggle, we need to understand that Allah has categorically stated it in the Quran that He gives glad tidings, several places, not one, not two, not three, numerous places where Allah gives glad tidings to those who are patient. So dealing with a child that has special needs, a lot of patience is required. And may Allah grant us that patience to deal with these children. Now, going directly to the topic, causes of disability in children. Of course, we will need to answer the question, what exactly do we understand by the meaning of disability? When you say a child has a disability, what does it mean? Well, by Oxford Dictionary definition, they say that disability is a state of physical or mental condition that limits an individual's movement, senses, and activities. People with disabilities can still chase their dreams and live quality lives. In other words, having a disability does not equal inability. So the fact that a child has a disability does not mean that this child cannot reach the optimum potential that every other child has in life. Fine. Children with disabilities suffer a condition of the mind or the body, and this makes it difficult for them to communicate effectively with others or to complete day-to-day activities the same way that other children or other peers would have done it. And this, of course, will mean that in a way, their life is somewhat limited. So when we are talking, you'll be able to realize that there are actually core aspects that these children will have issues with. They'll have issues with communication. They'll have issues, and of course, communication encompasses also their mental capacity and their intellect. They'll have issues with mobility, maybe issues with how to get from one place to the other, and then issues with self-care, how to do day-to-day activities, dressing self, bathing self, feeding self. These are core areas that children with disabilities would have some limitation, and we, as their parents, need to be there to be able to assist them through. Now, there are before we talk about possible causes, okay, so let's talk about causes of disability in children. Now, like I said from the beginning, it's a very broad spectrum of issues. So we're just going to look at some of the things that can happen that can result in a child having a disability. Now, normally, of course, we expect... Sorry? Okay.
No, continue.
Okay. Normal outcome of any pregnancy is for us to have a baby that is devoid of problems. However, some factors that may even predate this child's conception and birth can result in this child having special needs. Now, some of the things that can result in a child having special needs, chief amongst which is genetics. When we talk about genetics, we talk about things that will happen in the genes, because a child, of course, is a combination of genes that comes from the father and the genes that comes from the mother to combine in the child to form a unique being. Now, if there is a genetic problem already in either parent, this can result in the child having a genetic abnormality. It could be what we refer to as single gene abnormality, like it happens with children who have sickle cell disease, or it could be a chromosomal abnormality, in which the problem is due to a whole chromosome being affected. And these and things like when you talk about children with Down syndrome, children with some other that's the commonest chromosomal abnormality that children have, Down syndrome. And then it could also be one that is multifactorial, where apart from the genetics, you also have environmental issues coming into play. So the child could actually have some genetic issues. And once a child has been seen to have a genetic issue, once somebody has one child that has a genetic problem, it is incumbent on the parents to actually do a genetic study for themselves to be able to decipher what type of genetic abnormality did this child have, and then see a geneticist who will tell you the risks of it recurring again, so that an informed decision can be taken subsequently. Now, genetics, of course, even sometimes when a parent, the abnormality does not exist in any of the parents, occasionally we have what we refer to as mutations occur, where a disease that was hitherto not present in the family suddenly shows up. So in such cases, you say there was a genetic mutation that occurred in that child. Now, other things that can cause it, parental health and behaviors. Of course, if a mother is malnourished, it can have an effect on the child, and the child may not grow in utero, inside the uterus, to his full potential. Then we have children who have what we call, they come out with intrauterine growth retardation, and these can predispose them to some other diseases. And then maternal behaviors, smoking in pregnancy, taking alcohol in pregnancy, drug use in pregnancy, sometimes even some of the exposures that a woman is exposed to, environmental exposure in pregnancy. Even sometimes the drugs may not actually be hard drugs, it could also be therapeutic medications that can also cause abnormalities in these children. Like if a mother is epileptic and she's on anti-epileptic drugs, it could have an adverse effect on the baby. Same for a mother who has maybe a thyroid problem and she's taking some drugs to solve her thyroid problem, whether it's hyperthyroidism or hypothyroidism. These can have a way to affect the fetus. So these are causes, some of the causes of someone coming down with a child that has special needs. Birth complications, of course, a very common thing we hear about is birth asphyxia, or as we in the medical parlance, we like to call it perinatal asphyxia, because the issue does not just occur at birth. Sometimes there are factors that happen towards the end of the pregnancy that can adversely affect these children, that results in this child being asphyxiated. And when we say asphyxia, layman's terminology, it's like somebody is holding your throat and preventing you from breathing. So essentially, asphyxia means the child came out and he was unable to take or maintain that breath, the breathing. So either the child did not take in the first breath, or he actually took a few breaths and then for some reason the child nosedives and stops breathing. So that is when then that results in a situation where there is the brain is deprived of oxygen, and this can cause a cascade of events that will result in affectation of the child's central nervous system, and a myriad of other effects can occur. And this is what we refer to as perinatal asphyxia. And like I already alluded to, it could be a prenatal perinatal asphyxia. It could be something that happened during the course of delivery, or it could actually be shortly after delivery. Child was hypoglycemic, child had some other issues, and the child will develop and stops breathing, goes hypoxic, and then it can have this affectation of the brain. So birth complications can also result in a child with special needs. Now, infections, and this is a very broad group, because the infections could either be an infection from the mother that she has transferred to the child, in which case we call it congenital infections. There's an acronym we use in medical parlance where we say, like a torchlight, we say torch with an ES at the end. So torches, we say torches. So there are a myriad of diseases, like 4 or 5 or 6 different conditions that is encompassed under that word torches, which if a mother has any of those illnesses, she's likely to pass on an infection to the child that can have effect on how the child develops subsequently. Also, the infection could also be something the baby has. So a baby who has been born, and within that period when the baby's brain or the baby is still developing, the child develops a very severe infection, it can actually affect the child, and the child becomes a special needs child. A child that was born healthy now becomes a child that has some deficit or the other from infections. It could be meningitis, it could be poliomyelitis, any of those infections. A lot of those infections can happen in the early part of the child's life, and the child becomes a special needs child. Exposure to environmental toxins, and this could be either in food. You know, there's all these days we have a lot of talk about foods that have been genetically modified. We talk about exposure to pesticides, types of fertilizer that are being used these days. Talk about masks. We have all these masks all over with radiation coming from them. So all these kind of things are like toxins that can affect a baby in utero. And if the mother is pregnant and it affects the child, then this can affect the baby. And even after birth, if a child comes into contact with some of these things, these are things that can also result in a child that has special needs. I already spoke about malnutrition in the mother, causing a baby to be poorly developed. Also, malnutrition in the baby also can also result in severe wasting, severe stunting, and we have this thing we talk about the first 1,000 days of life of a baby, how it is critical that the child has adequate nutrition within the first 1,000 days. And these first 1,000 days actually starts from conception. So it's like the period from conception, the 10 months or 40 weeks that the baby does in utero, plus the first 2 years of life makes up these first 1,000 days. So the nutrition of any child is critical within this time frame, because that is the period of when the brain, most of the brain development happens within this period. So once we get it right, the child gets it right. So, but children who have been severely affected with malnutrition at that age can have some adverse effects that will affect them going subsequently. Now, other things that can cause a disability in a child is domestic or even road traffic accidents. A child can be perfectly okay, and he's going about and something falls on him in the house, or he gets burnt, or two children are fighting and one mistakenly uses something sharp to poke the other one's eye. So accidents can also make a perfectly normal child to transit to become a child that has special needs. And then, of course, we have endocrine issues also, like a child, like the thyroid gland. Thyroid gland, it's part of its function. If the child has hypothyroidism, it has a way of affecting the child's brain. So if this is not discovered early, then it will not be treated, and this child can actually come down with some form of mental deficit down the line. So these are some, I'm sure I've not mentioned all, some of the ways by which a child can develop, become a child with special needs. Of course, part of the things we also have are especially in the neonatal period, we have things like severe neonatal jaundice, a child who had jaundice and it was severe enough to damage the brain. Those children too could become children with special needs, and so on and so forth. So now we have children that have special needs. We like to classify them and try to imagine, okay, what are the problems that they have, so that we can have an idea how to help them. So I have like 4 broad ways you can classify disabilities in children. We could talk about behavioral or emotional disability. Then you could talk about sensory impaired disorders. We could talk about physical disabilities and then developmental disabilities. So there are 4 broad categories. For behavioral or emotional disabilities, we're talking about someone who has a condition that affects the mind or the body, and it makes it difficult for them to be able to communicate effectively with others or to complete their day-to-day activities in the same way that other children will be able to do. So for behavioral activities, how they behave, how these children behave is affected. It's usually diagnosed in childhood, and if it needs to be managed adequately in the childhood period time so that it does not affect the child subsequently in relationships, in how to get a job and all that. And when we talk about behavioral abnormalities or emotional abnormalities, we talk about things like children with anxiety disorders, children with disruptive or impulsive disorders, children with what we call dissociative disorders, and then pervasive developmental disorders, under which fall things like autism, fall, and several other disease conditions. I don't want to go too technical. So, and these, like I said, they are very broad. So it will be difficult for me to go nitty-gritty into all of these conditions. So after this, we will always have an offshoot where we pick one particular disorder and we talk about it to the as much as possible. So that's for things that affect the behavior of the child and how they behave. Then we'll talk about sensory impaired disability. These ones are, of course, it's self-explanatory. It's anything that affects the 5 senses: hearing, sight, taste, touch, smell. So a child that is visually impaired, a child that has hearing difficulties, a child that has problems with touch. Some people can't, the nerves are damaged, so they cannot feel. It makes it difficult because it makes it difficult to carry out some things because you cannot actually feel things. So children with visual impairment, hearing impairment, these are under sensory impairment. Now for the physical, which is probably the more common one that people see and can identify easily, these ones will affect a child's stamina, it affects mobility, their ability to move from one point to the other, and also the use of their hands and feet. This one will affect people, some of the physical things you see, a child who has physical disabilities, you see children with epilepsy, children with brain injuries, spinal cord injuries, where the child has paralysis, paraplegia, or what we call paraparesis. You know, maybe due to an accident, there's been some traumatic amputation of a limb or the other, or even some children are born with missing some limbs. So these are all things that can cause physical disability. And then we talk about developmental disabilities. This affects how a child will develop. You know, when we talk about a child maturing from birth up to adulthood, adolescence, we talk about 2 groups. We have what we call growth and we have what we call development. So in terms of growth, we talk about, is the child gaining weight? Is he getting tall? Is his head is he getting the right size of his brain? Does he have the normal BMI? We talk about growth. Now, when we talk about development, we're talking about how a child is able to develop, how he's maturing in communicating with his environment. Like under development, we say a child at 3 months, we expect a child to be able to, at birth, the child can't hold his neck. By 3 months, he should be able to hold up his neck. And then once he's 6 months, you expect the child to be able to sit without support. By 9 months, he should be crawling about. By 1 year, he should be able to stand up. So these are developmental issues. And then we talk about, those are like gross development. Then we're talking about fine development. if I give the child a pen, will he receive it with all of his hand, or will he hold it like somebody who wants to write? So there's an age a child will collect. If you give him something, he collects it with his palm. And there's an age where you give him something and he use 2 fingers. So these are like fine motor development. And then we have speech, development of speech, how the child talks. There's an age, especially child to be doing there's a child he starts doing bye. There's a stage he starts doing baba, mama, and all those kind of things. So, and then the stage he starts stringing 2 or 3 words. So this is all part of the developmental process. And then of course we have social development. Initially, they don't want anybody, it's only mommy they know. Then they start allowing other people to carry them. And then there's this point they don't even want anybody to touch them. And then they start interacting with people, smiling back at people. So there are different aspects to development. So a child who has a developmental disability has a problem that affects these core groups of methods whereby a child is developing. And it will impact his ability to learn. It will impact child's language development, and even it can initiate behavioral difficulties within the person. So broad group of issues these children have. When you see a child that has ADHD, attention deficit hyperactive disorder, a child with cerebral palsy, children with autistic spectrum disorders, and children with intellectual disabilities, and children with learning disabilities. Nowadays, some children will have some component of each of these problems, and then we just refer to it as global developmental delay. Nowadays, they try not to say a child is mentally retarded. It doesn't sound nice. So most of the time, they say the child is mentally challenged, or there's a form of mental disability. So these are like the 4 gross groups of disability that can be seen in any child. About these developmental disabilities, they tend to be very severe and chronic. They're usually chronic because most of them start from infancy and they prolong till the child grows, and it usually limits their lives. They impact self-care, learning, mobility, self-direction, economic self-sufficiency, expressive and receptive language, independent living. A lot of things are affected when a child has developmental disability. Now, just another classification I saw somewhere, they talked about it can be classified as being visible or invisible. Of course, visible means I can actually see this child's physical disability with the naked eye. So when you see a child that has Down syndrome, because they have a characteristic fascia, so it's easy to say, yeah, this child has Downs. And then a child that has fetal alcohol syndrome, well, you may not be able to see it since you're not a medical person, but I, as a medical person, because I know the constellation of features that they put together to say fetal alcohol syndrome, if I see the child, I'll know. So it's a physical thing you can see. Children who have motor neuron diseases, that it affects how they move. So some of them will have what we call muscle wasting, they will have tremors. So these are things that are visible, and people easily will be able to see it and feel sorry for this child. Children with cerebral palsy children, because cerebral palsy, by definition, we say it's a disorder of posture and movement due to damage to a developing brain. So it happens very early in life, but the effect is progressive. So a child with cerebral palsy, we have different classifications of cerebral. If we want to talk about cerebral palsy, we need a totally different class for that. So we have those that have what we call spastic. We have those that are atonic. We have those that they'll just be very stiff, and there are those that can move. Their hands are working okay, the legs don't work. Some of them, both hands and legs don't work. Some of them is just half of the body. So depending on which part of the brain was affected and where it controls, it now determines how the posture and how the movement of this child is affected. So, like I said, those that are visible, children who have had amputations. There's this other condition we call Tourette's syndrome. It's like the child has, the child cannot stop it. It's like having tics. So he just says things without meaning to. It's called Tourette's syndrome. It's also something that you can actually see it physically happening to the child. A child that has paralysis, a child that has epilepsy. These are all things that are visible and people were able to see that, yes, this child has a disability. And then we have the invisible ones, things like a child who has mainly brain things that are affecting the brain. Can you still hear me?
Very well.
Okay. Seems like my screen is frozen. Okay. Anyway, can you see me?
Yes, we can.
Okay.
We can see you too.
So for those invisible ones, children with anxiety disorders, children with bipolar disorders, children that have depression, children that have ADHD, obsessive compulsive disorders, all these ones are not visible to the eye. So a lot of people may not realize that these children have an issue, and then they'll just be wondering, why is this child behaving like this? Why can't he speak normally? And all those kind of things. And that one becomes a challenge. But people, the parents have to start explaining to people that actually the child has this issue and that issue, and it becomes a problem for them. So that's the classification of the disorders, and I've already mentioned what are the...
Doctor, we can't see you again, but we can hear you.
You can't see me, but you can hear me.
Yeah.
Okay.
Come here, Baba.
Sorry, let me see if I can solve that problem. Can you see me now?
Yes.
Am I back?
Yes, you're back.
Okay. And you can hear me?
Very well.
Okay. So I don't know why my screen froze. That was what I was asking, that can you see me? Okay. So that's the basic groups that we have, grouping that we have for it, and the possible causes that we've talked about. Now, we also need to understand that we have other medical illnesses that can now result in a child being, because the topic was special needs. So things like, people don't always classify children who have sickle cell disease as a child that has special needs. They are more like a medical, because it's a known medical condition. So it has its own medical, it has its own constellation of issues that they try to resolve, because it's more of the pain that they feel. So it's not something that you see so much, but it's just that because of what is happening, the pathology that is happening, they also tend to have a fascia that becomes like a physical disability, because when you know them, you'll be able to recognize them when you see them. So that's why a child with sickle cell disease will also be classified here. Other diseases can also result in some deformity or the other. There's this whole class of diseases we call inborn errors of metabolism, and like the name suggests, it's inborn. So most of them have a genetic basis. So the whole class of inborn errors of metabolism, they fall under genetic problems, because there's usually an abnormality that is causing either a lack of a certain substrate or factor or enzyme, and these just cause a chain reaction of abnormalities in these children. So there are a lot of issues that can result in a child that has disability. Now, of course, we talked about congenital disorders earlier. We have those ones. Some of these congenital abnormalities will result in a child that will have a lower than normal IQ, intellectual quotient. Children with Down syndrome, children with something we call Fragile X. There's another one we call Asperger's. There's a whole lot of syndromes that part of, because when you say something is a syndrome, that means there are several symptoms or signs that come together that is common to people who have that problem. So one of the problems that most of those syndromes will have is that there is a reduction in the child's intellectual ability. So that comes with several congenital disorders. Autism has been said to have some genetic and congenital part. Speech disorders, that's another big problem that can happen. And then, of course, some children will have heart diseases, or blood and metabolic disorders. Now, difference between disability and developmental delay, because that's something we talk about. Some children will come to the hospital and will say the child just has a developmental delay. We'll say, okay, come back after like 3 months. Let's see if the child has started doing that. I already spoke earlier about how we expect a child to progress with development. So when a child has developmental delay, it is when the child is learning skills slower than other children that are their age. So when you expect a child to have achieved neck control at 3 months, and the child is 4 months and he's yet to achieve neck control, the neck is still drooping, you say that child has a developmental delay, because there is a possibility that that child will eventually have that neck control and have no other problem whatsoever. So even though there are milestones, ages we expect a child to have achieved something, we still have some extra time we give for those who fall outside, because when they were forming, for those that have done a lot of research, remember the Gaussian curve, the bell curve, where 50% are in the middle. And then you now start going 1 standard deviation to the left, 1 standard deviation to the right, 2 standard deviations to the left. So space is allowed for those who are at the edge to eventually, because even as we are saying that a child should have neck control at 3 months, there are a lot of children, especially these days, who have, even at 1 month, they're already holding up their necks and looking around. So everything is changing. So we need to have that. So we say a child has developmental delay when he's learning those skills slower than other children. However, if those things last until the child becomes school age, then that child has a disability. So if you go to the hospital and they say the child has a developmental delay, it does not mean that child has become a disabled child. So that's just what I needed to clear there. And also, now the core of coming to the end of the lecture, what do we do when we as parents have found ourselves with a child or that has special needs? Well, I already tried to do the pep talk at the beginning and said how we should look at ourselves as special beings that have been chosen to take care of these babies, because it's a lot of work. It's not easy. It's not easy. And unfortunately, for some people, like the convener already said, she knows a family that has like 3 kids with a particular deficit. So for you to have 1 child, and then some people have 2, some even have more, it becomes a really tough. What do you need to do? First and foremost, you need to learn about that disability. And I find that very common amongst people in the Western culture. Once they come to the hospital and they give them a diagnosis, they have before the next time they see you in the hospital, they would have done thorough research, and they are coming to ask you all the questions they need to know about that disease. So once they say your child has this, you need to know well about it. It's something I used to do, because when I used to be in neonatology, so I catch the children as they are being born. And then those were admitted. And then when they come to clinic during the visit, follow-up visit, I'm like, why was your child admitted? I don't want to hear I don't know. You should know. Your child can be kept for a few days, brought back, and you never ask what was the problem. You should know. And you should find out what does it entail. So whatever disability this child has, you need to know as much as you can about this child's disability. Next thing is to ensure that there is early childhood intervention, because for a lot of them, there is something that can be done to make life easier for these children. So instead of just sitting down and say, that is how Allah has destined it. No, some of those things, as the same way Allah has, for the life, there's always checks and balances. The same way they will tell you, there's that hadith of, if there's the fly that dropped inside your drink, you should dip it back inside, because the cure is on one, the poison is on one wing and the cure is on the other. For literally everything as a problem, there are usually solutions to it. There are at least things that you can do to make the child's life, to increase the quality of life for that child. There's always something that can be done. Early childhood intervention is important. You need to see pediatricians or other health professionals. Some children, all they probably just need is to see a physiotherapist so that they can do some muscle strengthening exercises for them, and this will enhance and improve their mobility. Some children, they need to see an ophthalmologist. They check their eye. Oh, the child had a cataract. He was born with a cataract. All they need to do is remove that cataract and the child will be able to see. Some children have hearing deficits. Some of them, something is blocking because hearing abnormality, hearing deficit, it could either be what we call conductive or sensory neural. Excuse me for the big terminology. Conductive means there is something blocking, there's an obstruction somewhere. So it may just be to remove, prick a hole somewhere and the child starts hearing. For those that are sensory, it may be that they need to put a cochlear implant. All that can be done and the child's quality of life will be improved drastically. A child that has cerebral palsy, there are a lot of assistive devices that can be given to these children for mobility. I mean, we've seen, I know we may not be completely there in our country, but there are a lot of things that are there that can help these children to actually live a life that has quality. A child has a speech deficit, he needs to see a speech therapist. A child that has learning disability, it could just be that the child has a problem understanding letters. He can't read. The part of his brain that should coordinate is just not coordinating it. But if you put him in a situation where he needs to read, listen to an audiobook, he will be able to give you examine him very well just based on him using an audio, talking to him, explaining to him. Whereas if you ask him to read, you are stressing the child's brain, and then they get angry because they can't get it. And it seems like this child has anger issues and all those kinds. So we need to make sure they see all the health professionals that they need to see. Some children will need not one, not two, not three, several health professionals just to help them get a better quality of life. Of course, it's important to have support groups like this group that I have the honor to be speaking to this evening. It's good to have support groups so that you people can encourage each other. You tell each other things that you were able to do that made life easier. This makes having a child that has special needs easier to cope with. Seeing other people that have the same problem, like we always say, like if, okay, like we have a tendency to say when there's NEPA takes light, the light just goes off in your house. The first thing you do is you peep outside to be sure it's not just you, so that you know that, okay, it's a general problem, so we'll all solve it. So for as long as you can find yourself in a group, you know that you're not alone. It's not like you were singled out for any problem. So you can all, as a group, work and find a way to make life easier for these kids. There are non-governmental organizations that are there for several different classes or groups of special needs children that provide care for them. There are several non-governmental organizations. We talk about those that are for autism, there are some that are for for sight, yes, for sight, helping children who cannot see. You have those for sickle cell disease, organizations that deal and help them get the things they need that will assist them in life. Like where I currently work, they have very robust, in that they have a lot of these children with special needs. The government has also provided a way where people with children with special needs will apply somewhere for extra funding to help them get what they need. If it is food the child needs, if it is wheelchairs, if it is walking devices, whatever it is, the government is ready to provide. And for those that it is difficult, probably they don't have relatives that can care for them. They have rehabilitative homes where these children can be brought to and they will be properly cared for. So these are supports that parents and children of that have special needs require to help. Now, treatment, like I said, there are some of these special needs children that have treatment modalities. I've talked about vision, I've talked about hearing. Some of these, I talked about inborn errors of metabolism. Once they are well diagnosed early, and whatever it is that is, because I said it's either there's an excess of something or there is a deficit of something. If there's an excess, they are giving medication to reduce the production. If there is a deficit, they are giving that substrate to be taken orally. And these all as an injectable. These things can be replaced. If the child does not have enough growth hormone, you replace the growth hormone. If the child does not have enough insulin, you replace the insulin. So there are a lot of these things that can be treated. And once they are treated, all the other abnormalities that this child would have had because of this abnormality will automatically be phased out. And these children will be able to have a better quality of life. So it's important for this to ensure that you try to get treatment. No matter what it is, go and let it be diagnosed and treatment modalities to be discussed and meted out for this child. You need to accept, like I already mentioned from the beginning, that this child has this. Some of them, it's for life, and they will need to be assisted. I already also mentioned that it's a spectrum. Some of them, especially Down syndrome, they end up being able to cater for themselves. Some of them have jobs. You see them, a lot of them in these special Olympics that they do. A lot of people with disabilities are doing things, great things now. So having a disability is not a death sentence. It's not a keep the child in the corner, don't bring him out sentence. We need to do these things, accept it, and get what this child needs to improve his quality of life. We need to avoid discrimination. Like I already said, the fact that there are other kids that are healthy in the same family does not mean that this one should now be treated in a way that even the child will be feeling bad. And also, as we are also treating that one with his own unique way, we should also not abandon the others who are normal simply because they are normal. We need to find a balance on how to care with children with special needs. As mothers of children with special needs, we also need to take care of ourselves. We need time to decompress because it can be overwhelming. There are times that you just want to just take a break and just maybe go to a rooftop and scream, or just lie down and cry and just let it all out, and then you just continue. Because, like I said, we were especially picked for this task, and we need to do this task as we have met ourselves in it. Okay, I think I have spoken a lot. Okay, I have not used up all my 1 hour, 15 minutes. So I think I'll pause here so that our participants can also contribute or ask questions, and we can move on from there. Thank you.
Jazakillah khairan, Doctor. May Allah bless you. A lot of gem sense, and I've really learned a lot. If not for every, because most of us that have these children, we tend to continuously blame ourselves. Take the blame and never look at other reasons why these children were given to us. May Allah bless you. You said it all. So let's give time for questions. If you have a question, you can put your hands up, or you can type in the comment section. May Allah reward you. We are very, very happy. At least we know where to go. We know what to do. We know what not to do. We know how to get more information when we, for example, have a child. We know that we have to go to the hospital, not just relying on our neighbors or, oh, they said there's one drink they gave to so child. Doctor made it clear that 2 children are different. Sometimes it is just developmental delay. It's when you go and even take those things, it now affect the child. So please, as she has said to us, go to the hospital. Know what is actually wrong with your child. Knowledge is important. If you understand what, at least accept the situation instead of continuously blaming yourself. Accept it, then try to look for solution. It may not be what you are thinking, it may not be what your neighbor's child have. Go and get the information, go to the doctors. They know better than us. So the fact that your sister has something similar does not mean that you have the same issue. Go and, or you may even have a child that have autism, but on different type of autism. That is why they say it's on the spectrum. So it's not the same. May Allah bless you, doctor. So let's see. Sister Manan has raised up her hand. Please unmute yourself and ask your question.
Assalamu alaikum wa rahmatullah.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Okay, thank you, Sister Safe Zone, as usual. May Allah reward you. May all your effort, your labor, always doing so much good. May He count for you in this world and the after. Thank you, Dr. Amina. It was nice to see you on camera in such a long time. Yeah, it's always on camera anyway, but alhamdulillah. Okay, so this is my, maybe sort of like a clarification, or maybe doctor can enlighten us more. I understand that with special needs, the terms are always changing. Now I hear neurodivergent. This is neurodivergent. This is neurotypical. So with this particular field, the terms are always changing. So I wanted you to enlighten us more, because nowadays people lose. Oh, this is a neurodivergent child. Like, are they all not the same thing? The children on the spectrum are also known as neurodivergent. So I was hoping you could enlighten us more on this, because these terms change all the time. Secondly, like I've discussed with Safe Zone, I think that more and more sisters with children on the spectrum need to come together. Particularly if you stay in the same neighborhood or in the same location. Anytime you feel as if I just have to give up, I can't do this anymore, and that's time that situation can come in and help you. So really, for me, it's really more about doing more than just being on the same WhatsApp platform, giving more support, helping others. Because quite frankly, we have all gone through this time of, oh, I'm overwhelmed, I can't do this anymore, to, oh, okay, I think I'm better now. And with support comes understanding, comes empathy, comes realism that this is what Allah is destined for you, and you just have to make the best of it. So I'm going to allow other people to speak, but thank you, Dr. Amina. Please explain the neurodivergent and neurotypical terms used now. Assalamu alaikum.
Walaikum assalam. Do I reply or wait for other questions?
Okay, the way you want it, should we wait for other questions so that you take them once?
Okay, I think, like you said, it's a terminology thing. Nothing much has really changed, because the neurodivergent, neurotypical, it's still something that is used to describe children that are in the autism spectrum. The neurodivergent is a child that is in the autistic spectrum disorders. So it's just terminology. Like I mentioned during the course, that they don't use mental retardation anymore. They talk about mental disability, global developmental delay, and all those things. So they try not to, when they feel a word is may have stigma, they find another way to talk about it. So the child is it's still the same set of children. Nothing has changed. The diagnostic criteria are still as they are. They just use them to describe a child that is in the autism spectrum.
Okay.
Or children that have developmental disorders. Let's put it that way.
Exactly. Our next question, will take it from the comment. His sister said, is it possible for disability to occur if some drugs like anti-malaria and Cipro was taken unknowingly during early weeks of pregnancy, and what can be done?
Okay. See the word disability. Okay, we've defined what it is. Now the question: early weeks of pregnancy is also a spectrum. So what can happen to a child when he's exposed to a drug at 6 weeks is different from what will happen to a child when he's exposed at 12 weeks. So as someone who is pregnant, it is imperative that you speak with your doctor if at any point you need medication to know which one is safe in pregnancy for that period, because some drugs that are not safe in the first trimester are safe in the third trimester. Because in the first trimester, we have systems still being constituted. But in the third trimester, everything has taken their normal shape. They are just getting bigger, bigger, bigger. So anything that the child is exposed to at that point will not disrupt the development. But in that early period, there's the risk of disruption. So some of these drugs are not advisable in the early trimester. In fact, as much avoidance of drugs as you can do in first early weeks of pregnancy, the better. So is it possible? The question now is it possible? It is possible. It is possible. What can be done? The problem with what can be done is that more often than not, you will not see disability on the child is born, except for some reason, you are manifesting something that now makes them send you for a specific type of ultrasound to check for abnormalities. So if it's just a routine scan, nobody will be looking for abnormalities. But for like people who already have a child that has Down syndrome, more often than not, when they are pregnant, at around 19 weeks, they expect them to go and do a scan to check, to be sure that the child, there are parameters they look at in that scan to know, is this child likely to have Downs or not? So they don't routinely send people for those scans unless there is something that is you are showing that will make them say, okay, you need to do this scan. Let's be sure that there are no abnormalities in this fetus. So some of them may be so bad that it will actually show even in a normal scan. So in that case, you have had time to process what you intend to do how you intend to take care of the baby once the baby is born, because I'm not sure that getting rid of the baby at that point is a viable option. Next question.
Jazakallah khairan.
Oh, yeah.
The questions are increasing. So, okay. The first question, I think I jumped down. The sister was asking me if there is any organization that assists children. I think you should join our group. People post so many organizations, people doing free surgery for cochlea, some eye surgery, they post it. There's one GTB bank organizes for autism, so you get those information. And so I don't know if doctor have anyone, but let me add another question so she can take them together.
Yeah, I know an NGO that deals with sight in Lagos.
Okay.
With sight issues. It's called Restore Foundation for Child Sight.
Okay.
So I know there is somebody that has an NGO for autism in Abuja. So but I'm not very conversant with them.
No, there is one too with us, sister. She had one of NGO for autism too in Lagos. So inshallah, when we are done, you can message me. She lives in Magoda. I think the foundation is in Magoda too. Inshallah. Then she wants the next question. Jazakumullahu khairan, ma. Is it true that when vacuum is used during childbirth, it could cause developmental delay in the children?
Okay. First and foremost, before I answer this question, any treatment modality has pros and cons. There's rarely any treatment modality that has just cons. So now, before a treatment modality is used, they would have weighed all the options to see what is the best way to deliver this baby. Now, when you have a woman who is fully dilated, for some reason, she doesn't have a contracted pelvis, but for some reason, she's just not pushing this baby out. And the baby is already there. She has been contracting and contracting. The baby has gone through all this stress of labor. And at this point where the baby is supposed to come out, he's just stuck in the pelvis there. The doctor has to take a decision to bring out this baby. Now, it's usually done by people who have the expertise to do this vacuum delivery. So ideally, done properly, baby should not have a problem. If it is done properly, the baby should not have a developmental delay. So ideally, the answer to the question should be no, because this is a general question. Is it true that vacuum can cause developmental delay? No. But for everything, there are always exceptions. There may be a complication that arises that can now predispose this child to a developmental disability. Because developmental delay, like I said, in itself is not a problem. It's just the child just takes a little bit of time to achieve those milestones, but he will eventually achieve them. So no, I don't think you should refuse vacuum if it is a child-saving method for both mother and child, for fear of what may not happen.
Jazakallahu khairan. Okay, the next question. Okay, please, is it possible that some of these disabilities are curable, e.g. like seizures, epilepsy, ADHD?
Curable. More often than not, these diseases are more likely controlled than cured. What the drugs will do more often than not is to control it so that those symptoms that you can see get tampered down. Now, for seizures, like I said from the beginning, these are broad topics that one may need to sit down one day to take care of them one by one. Seizures, there are different types of seizures. There are some that on their own, by their natural course, they will go away after a certain age. So I don't know if we can now say the person got cured, but from having followed up patients with that type of seizure, we know that after like 3-4 years, this seizure is going to stop and the child will be okay. Some children, that's why children with epilepsy are put on anti-epileptic medication, and it's after 2 years of no seizure, they actually stop the anti-epileptic medication. Some children, after you start having seizures again. Some children don't have seizures again. So I'm not sure, because I don't know if we can loosely say it was cured or it just followed its natural course and the disease has gotten to where it stopped and it is no more a problem for the child. So seizures, I'm not sure we cure the seizures because by its definition, there is abnormal discharge. So if this abnormal discharge is because there is an abnormal way the cells connected, short of going there to reconnect them, which we don't do, the seizure risk still exists. So we may not cure them. So more often than not, we find a way to keep them at a base where they are not a problem. Same for ADHD. Most children, once you find what is causing this hyperactivity, like some children, too much sugar in their system causes hyperactivity. So if you take sugar out of the system, that hyperactivity will go down. So once you've done all these, that's why more often than not, for a lot of these disorders, we do what we call behavioral modification first, before we start talking about medication. So once the behavioral modification did not work, then we now introduce medication to try to treat it. I hope that answered that question.
Jazakallah khairan, doctor. May Allah bless you.
All the questions are not still plenty.
They are, they are plenty. So this one said, doctor, is it possible for one to suspend period? That is monthly cycle for a CP girl of 12 years?
Yes, the answer is yes, it is possible. But for that, you need to see the gynecologist.
Okay. How early can the autistic baby be identified? How early can an autistic baby be identified?
2 years. You see, identification is different from diagnosis. So if you have experience with children that are autistic, you'll be able to see a child, even from 1 year, 1.5, you'll be able to tell that this child is experiencing characters that is in the spectrum. But the diagnostic criteria, you cannot diagnose it before 2-3 years of age.
Okay, exactly, Kairan. Can we say a child of 1 year and 4 months who is yet to start walking on her own? She just started standing. Is she developmental delay? Is she having a developmental delay?
Yes, the simple answer is yes.
Okay.
I said we expect a child to have started walking by 1 year. So if at 1 year, 4 months, he's just starting to walk, the child's development was delayed. But like I also try to point out, that is not always a problem. Some children just do things slower than others. Like I know I talked about a lot of development. Teeth, we expect the child to sprout his first tooth at 6 months. That is what the books say. But some kids sprout earlier, some will wait until 1 year, no teeth. And eventually their mouth have the complete set of teeth, perfect dentition. So that a development was delayed does not mean it is a problem. So the child has started walking. Lillahi alhamd, please let the child walk and run.
Okay, Zakila Okairan, doctor. For people with genetic disability, do you know anywhere one can get genetic testing?
A lot of private labs, I know, do genetic testing. It's just that it's, there's Pathcare that I know. The one I know, Pathcare. There's this other one, I can't remember the name. They do those testing, but the problem is, I'm not sure they have the equipment in Nigeria. So some of them actually take those samples, send them to their main labs, wherever they originated from, get the result and come. So it may take a bit of time and it will cost some money. But yes, there will be labs in Nigeria where those genetic testing can be done.
Okay, Zakila Khairan. Please enlighten me on the development of it.
I'm not the one frozen. I'm not the one frozen.
Okay, did you hear me?
Enlighten me on development of preterm babies and risk of Down syndrome.
Yes, that.
I forgot. I was going to talk about preterm babies when I was talking about the development. Now, development of preterm babies, independent of Down syndrome. Development of preterm babies. A baby who was born preterm, we have what we call, they're distracting me. We have what we call hello, can you hear me? Hello? Am I still there? Hello?
We are with you. It's okay.
All right.
Well,
Okay.
Yes,
So for
yes.
preterm babies, we have what we call the post-conceptional age. Corrected post-conceptional age. Now, a child who was born at 32 weeks of life, that child has lost 8 weeks that he's supposed to spend in utero. At 2 months of life, when that child is 8 weeks old, his corrected postnatal age is like his first day of life. So that child is assumed to have just been born as far as development is concerned. So if a preterm baby who was born 2 months early does not hold his neck up until 5 months of age, that child is not considered to have developmental delay because he needed to complete his 8 weeks that he lost and then start developing like all the others. I don't know if I've made myself clear. So we consider preterm babies' development in cognizance with how late or how early the baby came out. Now, a child who has Down syndrome has Down syndrome. Down syndrome is a chromosomal abnormality. This is something that happened at the point of conception. So a child who has Down syndrome, the mother may deliver the child prematurely, but it's not because a child has Downs that he is born preterm. Did that make sense? So it does not mean that because a child
please come again. It doesn't make sense. Just come again. I didn't get that.
I said babies, there are a myriad of things that can cause a child to be born preterm. Down syndrome, chromosomal abnormalities is one of them. So the fact that the child has Down syndrome, child may be born preterm, but having Downs does not mean definitely the child will be born preterm. So being preterm is not a risk of Down syndrome. I don't know if you have, because it's the way the question is said, because it said, enlighten me on development of preterm babies and risk of Down syndrome. The fact that a baby is preterm does not put him at risk of Down syndrome, because a child that will have Downs already had Downs. But a child with Down syndrome can be born prematurely. Did that make sense now?
Yeah, it does. It does. Thank you.
Exactly, Hiram.
Oh,
Doctor, we are sorry we have exceeded your time, but it's just 2 questions. Also, my special need child, a boy is just 8, epileptic and also ADA child, seem to already be growing hair around his groin area. Is this normal? Please, I'm a little worried about that. He's 8.
Well, there are several things I need to know. Is the child on any medication? However, be that as it may,
The child is on medication, sorry. He is on medication. He's
on
on
medication.
medication, epileptic drugs, yes. Even ADHD for some time.
He's
He was
also
on
on
that
drugs for the
medication.
ADHD.
Yes,
Okay. So
yes.
what I'm trying to say is while I'm not sure about all the side effects that the drugs may have, it may be a side effect of the drugs.
Okay.
However, what I would advise is just to be on the safe side. It's probably better to see an endocrinologist.
Okay.
Because when we talk about precocious puberty, we say when puberty starts showing up at the age of 9 in boys and 8 in girls. So if he's having features that look like puberty is coming in, it may be precocious. So you need to draw the doctor who is prescribing those medications attention to it. It may be a side effect of those medications.
Okay. Thank you.
Second to last question. How do you take the sugar out of the system for ADH?
No, you're not taking the sugar out of the body. The sugar intermittently goes into the body. As in, the child is always taking jelly, taking ice cream, taking all these sugar-choked foods. So you just gradually take it away from the child. Because anything you take within 4-6 hours undergoes digestion. So that sugar, and then the body uses it up as energy source and it is gone. But if there's a constant supply of refined sugar, then there's that risk. So the whole idea is dietary control, dietary modification, to make sure you try to reduce the amount of refined sugars the child is taking in. That's the answer to that question.
Okay, Zakila Okairan. I think the last one finally. Is there any skill acquisition center for teenagers with learning disability in Lagos?
That question is not for me. I don't know.
Yes, I think there are. I'm going to send the link. I think there was a need to actually check around in Lagos. I know in Lagos. So there are some government school. I think it's called a government school for disabilities there. There's another one around, is it Shomolu? Don't worry, when I check, I'm going to paste it on the group so that I have them, someone sent them to me, so I will just forward them to the group, inshallah. So I can't remember the name vividly now. Jazakumullah khairan. Please, let's say Jazakumullah khairan to our doctor. May Allah bless you. We are grateful. Even though we have overused your time, you were patient with us and you responded to the questions. We've learned a lot. May Allah never deprive you of the reward. May Allah strengthen you. May Allah ease your affair. We are grateful, Dr. Jazakumullah khairan. Now, so, alhamdulillah, we gradually come to the end of the session. May Allah reward you for coming, for listening. May Allah make it beneficial for all of us. May Allah cure our children. May Allah give us the ability to bear this test. No one of us prayed for it, but for everything Allah has given us, Allah will test us with it, both good and bad. May Allah make it easy for us. May Allah grant us patience to bear. There are many companions that were blind, that had special needs. In short, I think the last one I know of was the Grand Mufti of Saudi Arabia. I was told he was blind and he was able to rise to that position. So our children are differently abled. It doesn't mean that they cannot achieve what every other person achieves. So inshallah, I want you to have it at the back of your mind that it's not the end of the world for that child. You will be a proud mother. Let's continue this path of knowledge, trying to know what they can do, the skill we can teach them. They may not be able to go to normal schools, fine, but there are other ways we can tap into their talents and they become great and do great things. May Allah bless you all. Jazakumullahu khairan. Subhanaka Allahumma wa bihamdik. ونشهد أن لا إله إلا أنت ونستغفرك ونتوب إليك. السلام عليكم.
وعليكم السلام ورحمة الله وبركاته.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you so much.
Now,
Bye.
now, assalamu alaikum. Bye.
Alaikum assalam.